Hello, I'm Robert Nelson with Luraco, and I'm here with Dr. Michael Olpin. Is I pronouncing that right, Doctor?
That is correct. Yes, Olpin.
Dr. Michael Olpin, who is the originator and creator of the Terra Firma app. This is a stress reduction or elimination tool, and Dr. Olpin is going to walk us through how this app functions, what it does. But first, Doctor, can you first give us a little information about, I find you to be a fascinating individual. Give us a little information about yourself and how you got started in the stress relief or elimination industry.
Well, I'm an old guy, so I've been around this world for quite a long time. It was in the mid 80s when I was diagnosed with high blood pressure. I was diagnosed with hypertension, and I was eating clean. I was exercising correctly. I mean, I was doing what you're supposed to do to stay healthy, but the doctor said, you're going to have to be on hypertension medication for the rest of your life. And I did not like the idea of being on medication for anything for the rest of my life. And at that time, I came upon some books that were on specifically meditation. And one of the things that there were several studies that showed that when you meditate in this specific way, it takes care of high blood pressure. And so I thought I would much rather, and I didn't know anything about meditation. I didn't know back then in the mid 80s, nobody was doing yoga. No one was meditating. And so I thought I want to learn how to meditate because I don't want to take drugs.
Right.
And the doctor said, you're going to have to because you chose the wrong parents. Your mom, my mom had high blood pressure, and both of her parents had been on medication for high blood pressure their whole lives as well. And so he said, you got the wrong genes, too bad. And I didn't want to accept that. And so I found a person who was teaching this particular type of meditation. It's called transcendental meditation. And the first time I did it, it was so amazingly different how I felt after I was done. During it, it seemed strange. It was a kind of a weird technique that I'd never even thought of before. But the guy who taught me said, just do it. It works. And so after I was done, it was like somebody had opened up my mind or my brain and just poured in cleanser. I just felt so clean and so like clear-headed. It was unlike a feeling. It was a feeling unlike anything I'd ever felt before, but in a very positive way. And I thought, this is fantastic. I don't know if it'll help my blood pressure, but I've never felt this good before. And so and he said, just do this every day for the rest of your life. And so, and that was in 1988. And my wife and I both learned it. And we have been meditating ever since, just about every day. There's a few days that we miss, but like today, I meditated first thing when I woke up. And I've never had any blood pressure medication for those 40 almost years. And that really got me on the path of trying to learn. The other thing that I've been an athlete my whole life. And one of the things that I really got interested in was sports psychology, because I'm short, but I play basketball. And so I needed something besides my tall. I'm not tall enough to play. So I needed something extra. So I learned about sports psychology. And one of the things that I learned is a inherent component with most sports psychologists is they teach their athletes how to play in a relaxed state versus a tense state, a nervous state, a stressed state. And they play better, or they call it the zone. And everyone's familiar with that now, but back then no one had heard of that. And so I started studying it, and I thought, this is what I want to do, is I want to work with people and help them to perform better by helping them learn how to relax their bodies, get out of the stress response and into a relaxed state, because virtually everything we do better when we're in a relaxed state versus a stressed state. And that doesn't matter. That could be an artist, that could be an athlete, it could be a person at work who's got lots of deadlines. It's all the same thing. When you're in that stressed state, nobody does better when you're in that state, and everybody does better when they're in a more relaxed, calm, confident state. And so I made it kind of one of my main paths or goals in life is to figure out how to help people, one, reduce their stress so they get into the relaxed state and feel good, and two, learn how is it possible to even prevent that from happening, to prevent stress from happening in the first place. And some people say, oh no, it's not possible, but I think it is. And I've learned the tools that seem to work. And so since that time in the early 90s, late 80s, I went to school. So I ended up getting my PhD, and every bit of my world has revolved around primarily high-level wellness and stress management. And so, which turned into writing textbooks, writing trade books, and creating this app and doing all these things. And I teach classes now that are 130 students in a semester that are all trying to figure out how to manage stress.
I'm glad you said that, because before we dive into the app, one of the purposes for us having this dialogue is because there are so many work-related or corporate wellness scenarios that you mentioned on your site. There are a lot of statistical data about the advantages to having some type of wellness program for the employees of a company or a corporation, so that one, it reduces the amount of absenteeism of that person being off because of stress-related illnesses. It, two, increases their capacity to perform creatively and productively while they're at work, which ultimately enhances the profitability of the company. And three, it actually enables them to have a degree of enjoyment in the work that they do that they can't without understanding how to use some of these processes. So with that said, tell us, how did you come about developing the app? How did that process come about? It's called Terra Firma.
So in my university class, I would teach it every semester, and invariably after we were done with the class, somebody would come up to me and say, I need you to teach this to my mom, or I need you to teach this to my aunt, or I need you to teach, because one of the things that we see happening with the application of the correct tools, which are in the app and in my class, is the symptoms of stress go away. So it's not the stress that bugs people. It's not we don't really know what's happening ourselves when we get stressed. We just know how it feels, the symptoms of the stress. We can't tell when our heart rate's increasing or our hormones are racing, but we feel the effects of that. And in the short run, no big deal. But if we're in chronic stress over time and the body's out of balance, then we have symptoms that take place: headaches, gut pain, muscle pain, fibromyalgia. I mean, just about every disease we know of in our society has a stress component, every single one. And stress makes every single one of them worse. And so one of the things we found in my class is that people, their symptoms would go away. They no longer have headaches. They'd fall asleep within minutes instead of hours. They would, I mean, I could tell you so many stories of where muscle pain would go away, fibromyalgia goes away, just anxiety would go away, and they'd also become better at taking tests, for example. They would be more clear-headed because they'd know how to get into a more calm state as opposed to a relaxed state when they're taking the test. And so everything seemed to work better. And they said, man, you got to do this for my brother and my aunt and my mom. They all need this. And so one person said, you need to write a book. And that turned into a textbook and a trade book. But somebody else said to me, you should create, you've got all this content, you've got all this, like, we videotaped all of my classes.
Mm-hmm.
I have 2 classes that are specifically mind body wellness and stress management, and we videotaped those. And along with that, I created additional books, articles, relaxation exercises for the class. And I thought, this is all ready for an app. And there's not really any good apps out there. There are some good apps that are designed to help people relax, some very good apps, but there aren't any apps that show people how to prevent stress. There aren't any out there that say, if you do these things this way, if you think about things in this way, you can essentially prevent the stress from happening versus try to stop the stress after it's turned on. And
right.
Which is why that's half of my class, is training people in how to prevent their stress from happening versus let's just figure out how to relax, do a deep relaxation exercise. Those are great. But in my mind, a good wellness program should be about preventing the problem before it starts versus trying to fix it after it's happening. And so
that's a key point, because one of the things that's unique about this app is that, and perhaps you can elaborate upon this, that this actually enables nurses to get credit toward their degree profession. Can you elaborate on that? How does that?
Sure. Yeah, I've been working with a company here where I live, and we were trying to, we started it right at the beginning of COVID. And as COVID was unfolding, and we also knew of some nurses, we recognized that the nursing profession right now needs more help than probably anybody, with all that was going on with COVID. And so, and we met with one of the directors here in this state in Utah and of the nursing program. She said, this is exactly what our nurses need. And so what we did is we went to their, I don't know how you describe this, their governing body, I guess.
Okay. Mm-hmm.
And we said, here's a training, and it's a set of 13 modules in a learning management system where you can go through each module, and essentially it's a scaled down version of the entire app, but it teaches you everything you need to know, or at least a smaller version of everything you need to know in order to handle stress. But they said, this is exactly what our nurses need. We will offer 15 credit hours of continuing education credit to any nurse across the country who wants to get continuing education credit. And so we're working with each of the states and have their people, their nurses, very involved with the app. It's really exciting to have it. But the interesting thing about that is the app itself and the training inside it is very generic. So it could work for anybody. We just happen to focus in on that one target audience of nurses because we recognize these people, we can really help them in a
Now,
way.
let me tell you why this is important and impactful. And this is for the audience. If this has the capacity to assist someone in a medical level profession, not that you have to be pursuing those type of outcomes, but needless to say, if it can help on that extreme level, then it can definitely help any ordinary individual to address those areas of stress. Yeah. So I really commend you for having a product and a service that is so potent, so powerful, that is recognized by governing bodies in the medical industry as a solution. This is more than a notion. So can you tell, how do we go about, as an average ordinary person, how do I go about accessing the app? What do I do? Where do I go? What am I doing? How do I get there?
Well, the app is available in the App Store, in Apple or the Google Store. And you basically download the app, and then once you're in the app, it's a small charge for it, and then you have access to virtually everything that I've created to make this very user friendly, depending on what your need is. So if you just need a quick tune-up or a recharge, we've got a section of tools for that. If you want to really dive into how to prevent and keep stress from happening on a big level, we've got a whole section in the app for that. And if you want to fall asleep really quickly, we've fixed just about every sleep problem that's come through. And we've had about 10,000 people who've done these relaxation exercises that I created, and we fixed just about every sleeping problem that has come through the class. I can think of 2 people who, at the end of the semester, I'll ask them, I'll kind of do a survey and how their sleeping is. There's only been 2 people who haven't had their sleeping habits or their sleeping performance. That's not the right word, but
their sleeping was in.
It was improved for everybody but 2 people, and those 2 people were on seriously heavy medication, and it didn't touch them. But everybody else, I'll ask them, how long does it take to fall asleep now versus at the beginning of the program? And they'll say it went from like 2 hours to 10 minutes. And everybody knows we all need better sleep. We all need a little more sleep. Everybody needs that. But nobody knows how to get there. And so that's one of the powerful tools that's in the app. We have just all of the classes that I teach, we videotaped. And so we go through class by class, and I've edited out everything that is non-essential. So they're not that long. It's not like you got to sit through an entire class listening to Mike talk. But so I've edited out all the unessential stuff. And so it's like, here's this knowledge, here's this knowledge, here's this knowledge. And at the end, you're going, oh, I know exactly what I need to do in order to prevent my stress. I know exactly what I need to do to turn it off. I know exactly how, and that's another section of the app that really isn't in any of the other apps that are out there, is I teach you the reality of stress, how stress really works. One of the things that people have the misconception about stress is that stress is something that happens to you like a pathogen. You breathe it in and then you're going to get stressed. I don't know That's possible. And so what we do is at the very outset is we kind of change that way of thinking so that you're recognizing that you're the cause of your stress. It's not somebody outside of you. If it were somebody outside of you, then there's no hope, because you can't do anything about what's outside of you. They influence us, but our job is to figure out how I can be with whatever's going on outside of me in a calm way. And so we get to the heart of how stress really happens. And it's quite an interesting discovery. There's some people who will say, I remember I was doing a workshop in Park City, and one of them came up to me after our first session, and she said, I've been through psychology classes and I've been through health classes, and nobody has ever explained to me how stress works like you do. And that has made all the difference for me. She said, as soon as you explained it the way you did, a light went off or turned on, and she goes, oh, I know exactly how to go in the direction of stress prevention and stress relief now, that I never had. And she was my age, she was mid-50s, and she'd never heard that before. And so it's kind of fun.
There is a unique relationship as far as why we're on this conversation together, is because being with Luraco, and Luraco is actually, it is a American manufacturer of various products, but one of the key products that they manufacture are massage chairs. Through much diligent research in reflexology, acupuncture, pressure puncture, they've devised methods by which a person getting a therapeutic massage, it is actually a medical massage chair, but that a person can get to that state of relaxation and eliminate some of those chemistry that ultimately causes stress.
Right.
Can you take us in, because I'm new to this process as well, can you share your screen and navigate us through to show us where would we go, or how would we access it if we were introducing this to a company as a part of their corporate wellness program, or a corporation to assist their employees with stress reduction or elimination?
I can, yes.
Walk me through, like, I'm new, because I am new to the process, but walk me through.
Sure. Essentially, we call this the Terra Firma app, and this is the desktop version, but it's also, most people it's available on desktop, and you can certainly access it from there, but most people use their phones, and so it would look a tiny bit different on your phone, but it's the same content, it's the same information. And what we have is, here's our kind of our home that has all of the different areas. It's kind of like a pie where we have a whole bunch of slices of the pie that make up this app. The first slice, and this is the one that was especially beneficial for the nurses for their continuing education credit, is this called release. We just named it release, the release course. So you would go in here to the release course, and it remembers you if you've been in here before. It has 13 modules along with an evaluation and a post-test. So you get a pre-test, it starts out with a self-evaluation. So you kind of get an evaluation of your own stress levels, and kind of based on that, here's kind of some things to think about as you're doing the course. And we go into the source of stress, the okayness of short-term stress, but kind of how stress works, the badness of chronic stress. And these are just like, you would go into these little sections, and it's just like a learning management system. so in this particular module, this is, for example, module 4, the effects of chronic stress. And so you're learning about that, how stress actually works when it's on for longer than it should be. And it includes video. So we've got short little video clips you can watch.
What happens when you stay stressed?
Mhm.
In the last section,
and then the script for it is included. We go down a little farther and we have a little lesson, kind of a learning experience.
Mhm.
That is, and each of these is a little bit different, the variety, but here's some of the different things that we know are associated with chronic stress, changes in appetite, blood sugar levels. And then one of the things we did in this release program is we wanted to make sure we're doing both things. We're doing training, so learning, and we also included relaxation in the mix. And so we have 20 different relaxation exercises, guided relaxation, and those are individually included in each of the modules as well, so that you're also getting that relaxation, and there's a sleep version of each of those so that you can listen to it while you're falling asleep to help you fall asleep really quickly. And so each module is not very long. They're not designed to be very long, but they are great information.
Okay.
These are just cool little kind of guess the right answer. I mean, it's pretty sophisticated. And
Okay.
then we explore how exercise works in this. I mean, how exercise works to reduce stress. Click on each review tip for successful exercise. So these are all based on research, based on what the science says about different ways to deal with stress. And then this section is the guided relaxation section, where we go through, there's a quick video each time that tells about that particular
guided relaxation, visualization.
That particular relaxation exercise.
It has been called going
because
to the
there
movies.
are many
And
different ones. I mean, I told you earlier about meditation, but there are about 10 or so different. If you went online and pulled up relaxation exercises, there's about 10 different types of, there's breathing exercises, there's progressive relaxation where you tense and relax. I mean, these are not these are all science-based, been tested relaxation exercises. And then we have down here, if you keep going, here's the relaxation exercise. So you just listen to this. It's me. I'll just
again, a deep breath in, majestic mountains reaching up to the beautiful.
And you do this with your
sky.
eyes closed, obviously. We made it pretty, but it's
notice a few puffy white clouds overhead.
And so, and the idea is, when you're like with guided relaxation, the idea is if you imagine something, your mind thinks it's the same as if you're actually experiencing it. And so if you visualize, say, a mountain scene or at the beach, and you do it thoroughly enough, your body gets the message, oh, I must actually be there, so I'm going to relax instead of stay stressed. And so it's really cool.
So can you stop your screen for a second? Because I want to touch on something right quick.
Sure.
I realize, and I've talked to many people who are completely oblivious to the benefits of meditation, and they are often stressed. But the simplicity of your learning management system, one, they have the ability to come in and actually get some information to have a better understanding about the whole phenomenon of stress. Two, they have the ability to actually test themselves to see whether they've retained the knowledge. And I really commend you for the structure of your learning management system, because as an educator myself, I see user interface is very engaging, it's very easy flow, and it's very logical continuity in terms of moving from one thought to the next. And 3, they have the ability to move to actual implementation through the exercises that you have. Having come from a space where I educate like young people,
Sure.
I realize sometimes when people mention the concept of meditation, it's like you mentioned, if you go online, you'll see a variety of things, and people don't know where to start. But
Right.
I think really made it very simple. Go to the first step in the release. And then from there, you can move progressively. Now, the benefit, the added advantage to an employer or a company is they have the ability to actually see progressive activity of employees that may have been engaged in that. And as you mentioned, those modules are very short. So it might be 5 minutes one day that they cover one topic, right? And that just taking that 5 or 10-minute time frame will have a dramatic impact upon the stress levels or the lack thereof of their employees. Is this correct?
Yeah, one of the things that I try to make sure that people understand with this app, and with anytime I work with anybody, whether it's wellness coaching or doing workshops, is you cannot quick fix stress. There is no, it's the same as you can't suddenly be Popeye. You can't just suddenly be strong first time you lift weights. It's going to take a little time. But the good news is, with each step that you take, you'll feel better. With each step that you take, the symptoms will start to subside a little more and a little more and a little more. And pretty soon, it's not immediate, but within and I just use the example of 2 or 3 months with my once a week with my students.
Once a week?
They're dramatically different. And so it kind of is a, you get out of it what you put into it kind of situation. But the good news is you'll immediately notice as soon as you listen to the relaxation exercise and you just let yourself be present with that experience, your body will go, thank you, man, that feels good. And then you'll start to get addicted to it, and you'll want to learn more, and you'll feel better. It's kind of like a positive spiral, as opposed to the negative spiral that most people are on because they don't know how to get out of it.
Right. And I'm glad you said that, because a lot of people, when I talk about meditation, I talk about these processes that you can use in order to gain control of your emotions, and in order to make yourself more receptive, to be intuitive and to be creative. But in terms of the return on investment to a company that may implement a program like this for the benefit of their employees, I know you've spoken to many corporations. Can you kind of give us a view or perspective of how beneficial could this be, and not just some woo-woo thing that you're just doing, but what application does this have as far as a bottom line for a company that can benefit by implementing a solution like this?
There is so much research, and just volumes of research that shows that when employees are happy, when employees are less stressed, they perform better. I mean, it's not even, and any HR person will say, going through difficult times, suddenly people are more sick. They're absent from work. When either the company's going through difficult times or the individual's going through difficult times, stressful times, I mean, there's a direct relationship between sickness and stress. As sickness goes up, as stress goes up, sickness goes up almost directly. It's kind of like your immune system works. As stress goes up, the immune system goes down. And that affects everything from cancer and heart disease to getting sick, getting the flu. I mean, everything. Stress affects everything. It doesn't mean that that there's something wrong with the person. It just means that they don't know how to handle the influences that are happening. And as a result, performance goes down, creativity goes down, happiness goes down. And when all of those go down, then it negatively impacts the entire bottom line and every line that there is in the company.
Mhm.
I mean, there are plenty of ways to promote wellness, but I can't think of anything that can have a more significant impact on overall well-being than getting somebody's stress managed correctly.
I'm glad you said that. And I really appreciate your input. In fact, the nature of our relationship is because Dr. Olpin at the university, what's the name of your university? The Weber, is it Weber?
Weber State University,
Weber State University actually conducted a study on the Luraco Medical Massage Chair. And can you just give us an overview of the impact that it had, like before and after, on some of the people who went through that? And I believe there were thousands of people that actually went through that experiment.
I'm trying to remember the number when we submitted. We've had 3 studies published, scientific studies in scientific journals that looked at. So what we have, just a brief description at Weber State. I direct this little area we call the Stress Relief Center on campus, and we have about 70 people, more or less. We have on the average about 70 people coming into the place per day. And we have quite a few tools, but our 2, I say 2 because we have 2 of the Luraco chairs. They are by far and away our most used and most enjoyed of the many tools that we have. And we have a lot of other things that work to reduce stress, but hands like probably 3 or 4 to 1. People use the chair. And so what happens is people come into our little center and we assess them. We assess them for stress levels on a scale from 1 to 10. We assess them for resting heart rate and for blood pressure and for stress-related pain. So like headaches, muscle pain, gut ache, whatever that is. And we have them identify where that pain is. So we assess those things. We have a database that's ongoing for many, many years. And then they do whatever they do in the Stress Relief Center. And most of all, it's the Luraco chairs. I mean, 4 to 1. And then we assess them again for stress levels, scale from 1 to 10, heart rate, resting heart rate,
11 o'clock.
blood pressure, and what was the other thing? Oh, pain, muscle pain, or any kind of stress-related pain. And so we ran the numbers. We did the statistical analysis to see if pre to post there was a significant difference, a significant change. And the people who we got statisticians on campus who really knew what they were doing statistically. And when they came back with the numbers, I mean, we had it was like 7,000 or 8,000 people who were part of this database. And they said, we can't believe these numbers. If this were a pill, this would be how do I say this? If this were a drug, it would be the best-selling drug on the market for stress, because the results were at the beginning, here's their stress, pain, blood pressure, and after they were done, it was to such a, and I've got to say this right, statistically significant power that it couldn't possibly be by chance.
Yes.
That they went from here to here. One of the coolest things about our place is we can demonstrate that this works. And then the other thing that we do is we kind of do a qualitative assessment beyond the quantitative, the numbers. We ask them, what was your experience of being here for that 20 minutes or 40 minutes that they were in there, or 10 minutes. I mean, it's all different times. And it's like we have a Likert scale from what's the highest one? Whatever the highest one, like wonderfully enjoyed it is the highest one, and hated it here. And it's like 95% of the people said,
yeah,
it was a fantastic experience. So we have quantitative data, we have qualitative data that both say that this particular chair or the tools we have in the stress relief center work, and they just keep working every single day.
Right.
I'm so impressed with the, I mean, I cannot talk enough about how great these chairs are, because I see it every day. I stop in there pretty frequently, and there's always somebody on those chairs.
Right. And they're very dependable. Now, the reason why I say that,
Oh gosh,
this is a very important factor for us. The fact that Luraco's massage chairs are the only American manufactured massage chair in the industry is a vital point. I'm sitting here in front of a wall of US patents that are held. So the engineering that went into that is American engineering that went into the only American manufactured chair. Also, it is the only chair on the market that has underwriter's laboratory certification, which is the utmost epitome of safety. Now, most people don't realize it, but whether you're in a corporation, hospitals, universities, there are certain liabilities that come into play. Because if you have an electronic machine like a massage chair, and if something malfunctions, like a fire breaks out, if it's not underwriter laboratory approved, some insurance companies will not cover what damage or malfunctions may occur. So for the utmost of safety, as well as the only chair that has scientifically proven statistical data validating that it has medical impact for the benefit of the users of the product. So I'm very, very grateful to have this opportunity to sit with you, Dr. Olpin, and to take the next step in moving toward stress-freeness, stress elimination for myself and for multitudes of people that we serve. Because as you mentioned, these are stressful times that we live in. The fact that you developed this, your app during the time of the pandemic, addressing one of the most stressful times on the planet Earth. And even since then, many things still are stressful in our society, but it behooves a savvy business owner or company or corporation to do whatever they can to benefit and maximize the reduction of stress for the employees that work with them. So this is one of the reasons why Dr. Olpin and myself are looking at providing some type of workplace wellness stress relief system that people can use and benefit from. So I really appreciate your input. Is there any advice that you would have for the audience? If you were to tell them anything, what would you recommend?
Well, whenever somebody, I have people come up to me when I tell them what I do. They say, "Man, I need some of that." And then they say, "I'm so stressed. What should I do?" And my quick answer is, "Well, just stay in the moment." And then they get this glazed look, like, "I don't know what that means. Stay in the moment. I don't know what." And so the real advice that I would give anybody is first, take kind of an assessment of yourself and say, how am I doing? Am I doing okay, or could I use some help? And then recognize, like I said before, that the process of going from stressful to stress-free doesn't happen in a second. And the good news is it can happen. Even in these very stressful times that appear to be extremely chaotic. If we're going to be in charge of our lives and feel like things aren't chaotic inside here, even though they look chaotic out there, we have to apply the tools that work. And there are some that work powerfully every time they're applied. And I love being able to share that with people, because when people's lights turn on, there's nothing better than to watch somebody go from crazy, chaotic to, man, I feel so good. That just thrills me to no end to be able to help somebody like that.
And it thrills me to have the acquaintance with yourself, because you're doing a fabulous work, doctor. And this has been an introduction into the Terra Firma app. If you want your stress reduced or eliminated, you need to take advantage, because the doctor has the tools. He knows the rules. You need to play the game.